ABMDI Registry exam questions and answers graded A+. Anencephalic heavy check mark, an infant born without a brain. Coronal plane heavy check mark, the plane that divides the body into front and back. E.G. Anterior ventral and posterior dorsal halves. Mid-sagittal plane heavy check mark, the plane that divides the body into right and left half S. Transverse heavy check mark, the plane that divides the body into top and bottom, e.g. superior cephalad and inferior caudal halves. Lateral heavy check mark, surface or portion of the body that points toward the side or away from the midline of the body. Medial heavy check mark, describes any surface or portion of the body that points or faces toward the midline of the body, e.g. mid-sagittal plane. 1/3. Proximal heavy check mark, refers to a relative position that is farther away from the central portion of the body or origin of the structure, e.g. the position of the hand is distal to the shoulder. Superficial heavy check mark, refers to a relative position close to the surface of an organ or close to the skin. Deep heavy check mark, refers to a relative position within the body or farther away from the surface of the body, e.g. farther from the surface. Auricular heavy check mark, the area of the ear. Temporal heavy check mark, the side, lateral surface of the head. Occipital AOE, the back, posterior surface of the head. Parietal OE, the area considers the top of the head. This area abuts the frontal, temporal, and occipital regions. Orbital OE, area of the eye. 2/3. Sternal notch or angle heavy check mark, the junction of the sternum and the clavicle relating to the T4 to T5 level of vertebral bodies. Submental heavy check mark, the area under the chin or jawline. Costal margin heavy check mark, the lowest portion of the anterior ribs, corresponding to the level of the anterior attachment of the diaphragm and L3, L4 vertebral bodies. Umbilicus heavy check mark, the navel. Pectoral girdle heavy check mark, the muscles, bones, and other structures responsible for the attachment of the arm to the torso. Axilla heavy check mark, the armpit region. Epigastrium heavy check mark, the upper portion of the abdomen bordered by the costal margin. Powered by TCPDF, www.tcpdf.org. 3/3.